Scott and Bill here with Kim Smyth from Astrazeneca. Thank you for joining us today.
Yeah, my pleasure. Thank
Great.
you for having me.
Could you tell us a little bit about you and your role at Astrazeneca and how that kind of intersects with IoT?
Yeah, absolutely. I lead a technology innovation lab in Silicon Valley. We've opened a small presence out here in our technology innovation and delivery. And my role is to help people in the company understand some of the emerging tech trends. We scout new, interesting companies, often younger companies, to work with. And we do proof of concept projects in areas of importance that we think would be relative to either our business or science units moving forward.
So for those viewers that are not as intimately familiar with the brand and the holding group, if you could provide kind of the key divisions, product divisions, and you mentioned the innovation and some of the startups. What are the areas that's of interest to you guys?
Well, Astrazeneca is a global pharmaceutical company. We operate right from early stage discovery right through to commercialization of products. We have three main therapy areas of focus. We have products in oncology, in respiratory, and in cardiovascular and metabolic or diabetes. So it's right across a number of different therapy areas, and right from discovering targets all the way to delivering medicines into cancer patients into our supply chain.
So that's a fairly broad scope and value chain. Mm-hmm. So where you could get into nanoparticles, things in the bloodstream, to AI, AGI that's doing deep learning, whatever it is, data for formulary and new treatments, to the delivery of robotics and injections and telemetry and so forth. So where are the areas that's of interest to you guys?
So for me, I work in IT. So I'm really looking at that where high technology or high tech is going to play an interest either in furthering the science or optimizing our processes. It's still pretty broad, but I think there's three broad areas that we're interested in or that where things tend to fall in. So obviously big data and advanced analytics, AI, whatever we want to call it. And that's broadly applied to many different areas. The second one, I suppose, would be in next generation user interfaces. How we're going to be interacting with computers moving forward, so voice and conversational UI, but also what's coming next. And then smart connected devices. I focus in Silicon Valley and more on the commercial and digital health aspects, and we have a sister team in Cambridge that is focused more on employee-facing and early-stage R&D.
So if you could share maybe one or two examples of startups or technologies that you've actually internalized for proof of concept or how that works.
So, we've done a few in, looking at search capabilities for scientists. There's a lot in the data and analytics space. Almost everything has had, up until now, that kind of underpinning. There's service providers, that are providing kind of IT tools and platforms and then we don't need to get specifically into the use cases. We also work with a lot of the innovation groups. So if, we have a number of groups that are looking at how to have complementary devices or mobile services attached to our products to help with clinical support or to support patients in taking our therapies. And so we work with those groups to either look at providers they should be thinking of, potential partners that they could use to deliver. There's a lot of work right now going on in respiratory. And increasingly, as we see devices becoming a really important part of that, I'm here, probably less to tell you about the stuff we're doing on the ground and kind of more to learn about what we should be thinking about as that becomes an increasingly important part of how we go to market and what is accompanying our drugs.
And what kind of challenges have you faced internally in terms of communicating that, in terms of acceptance? It sounds like you've got a pretty good plan and pretty good corporate backing in terms of that. Is that fair to say?
Yeah, I think so, but I think there's still an evangelism, that has to take place. Our core business is really around discovery of the science and the molecules or the biologics, and so sometimes, IT may be seen as more of a support or enabling function. I think there are pockets of groups who believe very passionately that it will become integrated much more into the medicines, but the company itself is, has a long legacy of operating under the current model. And when you start introducing those kinds of services or getting information back from our devices, whereas maybe we used to just sort of, leave molecules or like pills or orals at a warehouse, it's a very different business model and way of thinking about data and what you need. So I would say there's still a lot of people to bring along the journey.
Well, I think I'm very impressed with both the scope and the breadth, and I think it is very much an instigator in many ways of pushing the large organization to change and recognize that there are disruption that's coming, which could be incremental, it could be tectonic shift. So whether it's quantum computing that can provide new ways of solving problems that wasn't feasible before, to the way we actually not just do the drug compliance, but why do they have certain diseases, and understanding the lifestyle and the circumstances, because now we're able to actually understand them in the space of their home, space of their car, in public spaces, and how they actually smoke 3 times a day, or versus taking the long route to the park, as an example, and how those things contribute to different things beyond just what their DNA and their heritage.
Yeah, I mean, I think that's one of the exciting things about IoT. If I look further out into the future, sometimes it's easier to see what it might be giving you in 10 years than what you should be doing about it in 6 months, right? But there are all these things that have been invisible, really, to science or to the medical profession or to clinicians about what patients are really experiencing or doing, how foods that we eat might impact what we do, how activity levels, and I don't think IoT will solve all of that. I think there are many things that can't necessarily be measured by a sensor or a device, at least in the foreseeable future, but it will help make some of that more available. And I think there's a very rich vein of discovery in terms of finding those new correlations. But it's still pretty early.
It is very early, but I think eventually what's going to happen is when our clothes are able to capture information about ourselves, when things inside our body that's implanted or in our bloodstream captures information about ourselves, and an environment that interacts with us and then captures information about not just that geospatial dimension, but how we're behaving. Because a lot of these diseases may be a result of lifestyle, but also psychological as well. And how we view the world can also have an effect in terms of how we overcome disease or how we experience that disease. It's very, very interesting, and I wish we had a little bit more time, but with that said, Kim, I want to thank you for your time.
Thank you again for joining us.
Well, thank you. Great talking with you. Enjoy the rest of the conference.
Likewise.